Oftentimes, as a holistic practitioner, I am asked about hot topics, and I love hot topics. I want to be educated on hot topics, and I want to be able to discuss them with my patients. So one of the really big hot topics that comes in my clinic almost every single day is leaky gut. When I think about the physiology of leaky gut, it's really gut permeability is what it is. And so you basically in your gastrointestinal system are a tube from your mouth down to the toilet. And that tube is a factory. And so you put food in and you chew it, and you've got all of these enzymes in your mouth. So amylases in your mouth, proteases in your mouth. And what you're trying to do is break down the food before you eat it. So if you're ever on a diet and you're like, I'm gonna just chew this carbohydrate and then I'm gonna spit it out, your body already started doing that. Just kidding, but that's true. So then what happens is it goes into your stomach, and the only thing that you digest in your stomach is alcohol and aspirin. So you're not digesting anything in your stomach. So now all you're doing in your stomach is making chyme. So what that is it's mixing with your hydrochloric acid, and it's just trying to make food that is going to be breakdownable in the body. And so the other thing is that if the stomach acid is off, gut permeability is going to be way worse. So then it shoots into the duodenum, and that's the upper part of the small intestine. And right at that small intestine is where a lot of things are meeting. The bile is coming in with all the digested fats and hormones and everything that's kind of come through the liver, and then the pancreas is shooting in digestive enzymes. One thing important to remember is if you have a candida infection, this is where it likes to live, because basically it's being fed there all the time. And so people who have like a backed up bile, or they eat fatty foods and they feel really sick there all the time, they need to get checked for candida, because it's a really hot spot for the candida, because it just sits there and eats and makes things sticky so it can't come through. So now you've got this huge amount of small intestine, and the small intestine is basically where you're absorbing water, and you're trying to just kind of absorb the fluid. So now when it goes into the large intestine, you're going to make this nice banana-like stool. And so now it goes into the small intestine, and this is where absorption really starts to happen. So now let's say that this is your small intestine, okay, and you have eaten chicken that day. So now the stool is coming down, and these are all cells in your body, and that piece of chicken needs to go through the fenestration, or a fenestration is just where two cells meet. And so it will go through those cells, and there's thousands of digestive enzymes or bugs there, and they're going to digest your food as well. This is another part of the microbiome. So now that food comes through, and let's say that day you ate chicken, and chicken breaks down into 20 amino acids. And amino acids they're the building block of the body. So now where that chicken breaks down in 20 amino acids, you have phenylalanine to make dopamine, you have 5-HTP or tryptophan to make melatonin and serotonin, you have tyrosine, you have all of your BCAAs in order to make rebuild tissue and muscle and all of that stuff. So these are the ingredients that your body needs. This is why a lot of issues start with leaky gut, because you're not being able to digest those foods to make amino acids to rebuild hormones, tissue, thyroid, all of that stuff. So now what happens, instead of your gut looking like this and it being tight, it now looks like this. So these cells together are loose. So now what happens is, let's say that you ate a piece of chicken that day. It's been in your digestive system for 48 to 72 hours. It comes through now as a fermented piece of chicken, or fermented piece of protein. So it didn't break down to the 20 amino acids. It's now a piece of protein that's been in the system. It's fermenting, it's creating ammonia, it's creating all of these problems. So now, instead of having what you need to rebuild the body, you just have this kind of piece of food-like particle that is now inflammation. Now there's a big link between, if you've got leaky gut barrier, you've probably got leaky brain barrier too. And so it's going to cause a lot of brain fog, it's going to cause a lot of gas will be created. Another big thing that I see with my patients is their ammonia levels will be high. And a symptom of high ammonia is that your hands will crack, your hands are red all the time, they're really super dry, there's eczema, your lips are always dry, there's always brain fog. Another big thing with ammonia is you're having a lot of pain. And so I always start there too, because ammonia can cause a lot of problems in the body. Now, the other problem is that you're hitting the liver again, right? So the liver just detoxed all that, and now you reabsorb all this stuff, and the body goes, I don't have anywhere to put this. So it will deposit in the joints, it'll deposit it in the thyroid, it will deposit it in fat cells, and now the system, instead of a good functioning, very well organized factory, you have a chaotic factory. It's not clean, people aren't aren't taking out the garbage, and so now you have a really a big issue with multiple problems. This is why so often leaky gut's gotten this huge, exciting title, because it's really where a lot of things start. You have to be able to digest your food, or else you're going to have problems. Another big thing, a lot of practitioners are using glutamine to treat leaky gut, and it's just one thing that's important to know is glutamine for patients, it can be really, really good. I never usually start with glutamine for gut permeability or leaky gut, and here's why. Glutamine breaks down into glutamate, and glutamate will become GABA. But if you can't make it into GABA, you're going to make this huge amount of glutamate, and it makes you really anxious. So if you are treating leaky gut and you have anxiety, maybe please call a practitioner that specializes or knows how to treat this, because if you go online and you see, oh, glutamine for all of this, and you're already really anxious, maybe slightly depressed person, it might exacerbate symptoms. So I just want to say that it's a huge, lots of my patients are taking glutamine for leaky gut. They're not doing well at the beginning. I do eventually bring in glutamine, but there's multiple other things that we have to do. If you're having heartburn, the other problem is that your stomach acid is not working correctly, and so you're not breaking down that food, and so you're making kind of like chum for the bad bacteria. So if you ever do a stool test, we do a lot of stool testing here, we might map your microbiome and the bacteria in your gut, and lots of times there will be an overgrowth of staph or strep or prevotella or morganella or some of these other bugs that really shouldn't be in the gut. It's because your stomach acid is off, and now what it's doing is it's feeding the bad guys and it's starving the good guys. One other thing that I think is important about leaky gut is you need to understand why you're having leaky gut. Leaky gut is not a normal thing. Some babies, actually almost all babies are born with leaky gut, and it should eventually close. That's why breastfeeding is so good, because it's got the colostrum in it. It has the antibodies from the mama. There's lots of really good reasons that it's good for you. But another big reason that leaky gut needs to be treated is because if you don't treat it, then you're just going to keep having problems with it. So one other huge part to this is that patients come to me and they're like, I've been on collagen forever, and it's really important to know that it takes about 1.5 years. That's the longest to treat leaky gut. With some of my patients that are like really gun-ho and they're going to do everything and they're going to take out the foods, it can take 6 months. That's the shortest I've ever seen it, and that's people who already have their diet and their supplementation and stuff taken care of. The other thing that happens with leaky gut is gluten breaks down into gliadin, and gliadin is a huge molecule that the body really hasn't evolved to have an enzyme to break it down. So carbohydrates are broken down by amylase, protein is broken down by protease. There's lots of things that are broken down that the pancreas can make to break down. There's not a lot in the body to break down gliadin, especially the way it's been genetically modified in the United States. So that means you eat gluten, it goes into the system, and now you have this huge molecule of gliadin to be broken down, and it doesn't really break down, and so what it does is it paper maches your colon and it keeps it leaky. And so now what you're doing is you have this huge amount of gluten in here or gliadin, and you just can't close the gut up. So you really have to take high processed gluten out of your diet in order to do this. Another thing that will happen is candida will get into this leaky fenestration, and once you clean out the candida, it kind of will poke holes in here, so you have to go in and cement that closed as well. So leaky gut's a big topic, but it's important to know A, what's causing it, B, how long is it going to take you to heal, and C, what symptoms are being caused by leaky gut. Thank you so much for watching our video. Please subscribe below so YouTube knows that you like this content. Ring the bell. Much more to come, and please leave a comment if you have any additional questions or comments. Thanks a lot.